I came across this patient who, when she was in the manic phase, she would really walk out onto the middle of a shopping street wearing only her swimsuit. And she feels that this is okay. This is Singapore. We should be free.
To some, people with bipolar disorder can seem like they have very extreme moods, but there's more to it than just having very high highs and very low lows. It is a mental illness that causes unusual shift in a person's mood, energy, activity levels, and concentration, making it difficult to carry out day-to-day tasks. As entertainers such as Selena Gomez, Halsey, Kanye West, and more have opened up about living with bipolar disorder, the condition has been in the spotlight more so than ever. In this episode, my very special guest is Dr. Jared Ng, founder and medical director at Connections Mind Health, a clinic that provides holistic psychiatric and psychological services for children, adults, and families. Is it euphoria or depression? Listen on to make the world a better place. Hi, Dr. Jared. Thank you very much for joining this podcast. It is such an honor to speak with you today.
Hi, Brian. Thanks for having me. I think it is really an opportunity for me to engage your audience and yourself on how we can educate people on what mental health and mental illnesses are about.
First things first, tell us all about you and your journey thus far. What were your first steps into mental health, and what is the end goal that you have set in place for everyone?
Well, I think that one can be a topic for a podcast that lasts hours, since I'm not a young man anymore. I think I first started to be interested in mental health when I was in junior college, and I was really quite fascinated when I was asked to do a GP paper about someone famous, and I ended up doing some background searches into Sigmund Freud, and that was really how I got interested in mental health. Along the way, definitely I met people who was very inspiring. I think people who was very willing to share their knowledge with me. And I saw how they manage patients, how they talk to patients and treated them holistically, not just one part of them or not just an illness. So I think that really set me on the path towards this journey on mental health. I've worked in the military. I've worked at a restructured hospital. I work in community psychiatry. And my last job before I left public service was that I founded the Department of Emergency and Crisis Care at the Institute of Mental Health. And it was there that I got really quite involved in working on suicide prevention. And I think I saw how people suffered. I saw how families suffer. And I think one of the driving force between coming out to private practice is really about see if I could make a difference in another part of Singapore. I get a chance to work with corporates. I get a chance to interact with people from different walks of life. And all with the same goal is to really create holistic care for patients through psychiatry, through psychology.
Let's start with the basics. Could you give us an overview of how bipolar disorder is defined and diagnosed? I know that there are several subtypes in the diagnostic, but how do I exactly know if I have it? Is it like a mood swing where I wake up one day in a really low mood that I can't seem to shake for days?
I think bipolar disorder is talked about a lot, as you did say in your introduction. I think many artists proclaim that they suffer from it. But when we understand bipolar disorder, it's actually a chronic mood disorder characterized by extreme mood swings. We know a lot about depression, but the other end, when patients develop what we call manic or hypomanic symptoms, when they feel very high, that's also going to be a problem. As you rightly pointed out, Brian, there are different subtypes: bipolar 1, bipolar 2, cyclothymia, when they have got milder mood swings. I think we need to monitor. I think when the patients have got prolonged episodes of low mood where it lasts more than just a couple of hours, when it lasts for days or weeks, or when they have episodes of elevated mood, so high, euphoria, that lasts for days or weeks, despite external circumstances, it might be a sign of bipolar disorder. A lot of times they may have other symptoms, like, for example, when patients have got depressed mood, they may also present with difficulties with sleep, feelings of guilt, appetite problems, poor concentration. When patients have got elevated mood, symptoms of mania, they may feel that they don't need to sleep. They have a lot of risk-taking behaviors with very, very poor judgment. They might talk very fast. They might have thoughts that go on very, very quickly in their head. And all these symptoms, both symptoms of depression and mania, hypomania, they usually lead to some form of impairment, whether is it in their personal life, schools, their career, or even their family. When it has an impairment, I think it's important to seek professional help. I mean, certainly diagnosis should be done by a healthcare professional, a doctor, a psychiatrist, rather than go on to, I don't know, some websites online that proclaims that they have or they have not a mental health condition. I think it should be done by a professional.
What do we know about the causes of bipolar disorder? Is it genetic or can it be caused by a traumatic childhood or life experience?
So bipolar disorder, as with many mental health conditions, has got both genetic and environmental factors. It's always back to that discussion, is it nature or nurture? So we know that bipolar disorder is genetic because it runs in family. We do see that it can be passed down from parents to kids. It's definitely not 100%. I think some parents or some people have this view that if I have bipolar disorder, it is 100% sure that my child would have bipolar. That's not true. There's a higher risk, but it's definitely not absolute. Things like trauma, childhood adversity, stressful life events, they may not cause bipolar per se, but they certainly can trigger it. They can contribute to the onset. So as with many mental health conditions, it is important to understand that it is multifactorial, not just caused by one specific experience alone, but many, many different things coming together at the right time and contributing to the onset of the disorder.
There's an idea that bipolar disorder, particularly what you have mentioned, the manic phase, is linked to creativity and the traits of a creative genius. Is there any truth to that? And what's the most common one that you've come across in your practice thus far?
Sometimes it's a bias, right? As you mentioned, a lot of the artists would say that they have got bipolar disorder, and not just artists recently, but we also read reports of how famous painters like Van Gogh also suffered from bipolar disorder. So I think this contributed to that myth that mania is associated with creativity, with the arts. I must say that in my career, I've really seen individuals that report heightened creativity when they are manic or hypomanic. But we need to know that during this time, they don't just become more creative. It's not just one isolated symptoms. They could start taking a lot of risk. They start to perform dangerous behavior. They start to do things like overspend money. They start to make very poor judgment. And this takes a big toll, not just the condition takes a big toll, not just on their physical well-being, their emotional well-being, but sometimes it's a reputational risk. I came across this patient who, when she was in a manic phase, she would really walk out onto the middle of a shopping street wearing only her swimsuit. And she feels that this is okay. This is Singapore. We should be free. And she attracted a lot of attention, and people would be taking photos of her, posting on social media. And you can see how this became a reputational risk. Yeah. Another misconception that sometimes people have is that this is just normal mood swings. But actually, bipolar disorder is a very complex disorder that involves not just moods, but a person's energy level, their cognitive function. And it's a disorder that affects interpersonal relationship quite significantly. It can be very, very impairing. So we definitely need to educate patients, caregivers about this. Yeah.
I understand that psychotherapy, also known as talk therapy, is one of the most effective treatments for bipolar disorder. However, there are many different styles and it can be hard for one to know which to choose. How do I know exactly which style will work best for me and what kind of therapeutic goals can I look forward to?
I think psychotherapy certainly plays a very important role in bipolar disorder, as with many other conditions like anxiety or depression, but it is often in combination with medication. I think a combination therapy of both medication and psychotherapy would be really, really useful for patients. Therapeutic methods like cognitive behavior therapy, CBT, is definitely very effective for mood regulation. We do use that in patients with depression and bipolar depression. In bipolar disorder, there is also this therapy called interpersonal social rhythm therapy, where it helps patients to manage their daily routines and sleep cycle. I think one thing which is talked a lot about, and also at the same time not talked about enough, is the importance of therapeutic alliance. I think it's important for patients to form a good rapport with the therapist. If we put it simply, the patient must like the therapist, and they must be able to click. Sometimes I joke with patients, even though it's not really a joke, that finding a right therapist can sometimes be more difficult than choosing a partner, because you're going to talk about very, very difficult topics, very deep things. And it can be quite difficult if there's a barrier, if you don't click with the therapist. So therefore, I think choosing the right therapist is important. Only when you choose the right therapist, you have a good rapport, then you can discuss about individual needs and goals of therapy. And certainly if the therapist is skilled, can certainly help patients to guide this decision, what the needs and goals are.
Do you have any past examples of clients who have consulted your help in dealing with bipolar disorder and have successfully regulated it after?
Of course, I can't go into actual names, but I remember seeing this young gentleman. He was depressed, right? He had depression, and at the time, he shared with me that his father actually had bipolar disorder, and he was very concerned that he would develop bipolar disorder like his dad. And what happened was that stress in itself, that worry, actually became a big source of concern for me, because he will start to always check his own symptoms. He will ask a lot of people whether he's going to develop bipolar disorder. He went really deep into research. Unfortunately, one day he did. What happened was that he was arrested by the police because he started to harass passerbys, and he was brought to the hospital. Of course, we saw him, and really he needed to be admitted to hospital because there was some dangerous behavior as well. And I'm glad he took part in a treatment, because through a combination of medication and therapy, he got discharged soon after. I think the family also got involved, and because they have experience of dealing with managing someone with bipolar disorder, they were able to really understand and empathize and manage the patient. And with lifestyle adjustment and coming back for treatment, he actually got much better. And then he completed his tertiary education. And what I understand is that he's doing very well in life right now, and he's still taking medicine. So there is really a great importance of patients adhering to their treatment plans, and then be willing to have ongoing monitoring. And when I say monitoring, it's not that they are being sort of spied on by doctors or what, but it's really monitoring by the parents, by the friends, that they know that, hey, okay, I think he's talking faster than usual. I think something's going on. Or they see him, or they see him buying a lot of stuff online, right? This is another thing which some parents tell us, that when they notice the kids' online shopping habits becoming overspending, buying a lot of pointless, worthless things, that is a clue. There's a clue that the child may be having a relapse, or the person may be having some symptoms. Yeah, and definitely, I must say that treatment needs to be individualized. It needs to be tailored. I spoke a little bit about the use of medication together with therapy earlier. The choice of medication is important. We need to pick the right medication with the right effect, and there must be also care given to choose the medicine with the least side effect for the patients. I think only then that will patients be more confident in the treatment, be more willing to be part of to take part in the treatment plan. Yeah.
There's always this internalized stigma of mental illness equaling weak or ugly or bad, leading to the reluctance to seek help or treatment, etc. What can individuals or corporations do to reduce the stigma surrounding mental illness and break down barriers?
I think stigma is another huge topic that we could spend an entire podcast talking about. It often arises from a lack of understanding. I think centuries ago, or we don't even need to go back to centuries, there are sometimes people think that mental health condition, including bipolar disorder, it's not medical. They think that it's spiritual. They think it's supernatural. And some people even think that, oh, you're just weak, right? But bipolar disorder, just as many other mental health conditions, is a medical condition, like hypertension, like heart disease, like diabetes, right? And it shouldn't be seen as a weakness. I think that's very important. I'm glad that many corporates, many companies now have got mental wellness program. They have implemented employee assistance program, and we have got champions identified in the companies. We have got leaders where they normalize discussion about mental health. I think that allows employees, workers to be more willing to talk about mental health issues. Of course, having good insurance, having companies who is willing to pay for mental health treatment, just like they pay for physical health treatment, is also going to encourage people to seek help. Certainly on an individual level with friends, with family, I think encourage empathy, learn more about the conditions. If you know that someone could be suffering from depression, bipolar disorder, anxiety, certainly learn more about it. You can go now. There's so many websites. The government have got websites that looks at a mental health mindline, for example. You can go to those websites to find more information. Have open, honest discussion with people you care about. If you think that they are suffering from some kind of mental health distress, accompany them to seek help. I know a lot of times one of the most favorite question that I get when I give talks is that my friend, my family don't want to seek help. What should I do? Don't take no for an answer. It's not yet. And you tell them that you'll be there for them, accompany them when they go for their appointments, when they go for their initial appointment, show that you care, be there for them. I think that's really, really quite crucial.
Dr. Jared, I do think what you've mentioned is exactly and incredibly right. To illustrate further, if we actually eliminate the stigma around mental health slowly, per se, it spiderwebs into this whole other social conversation about letting people be who they are, like fighting toxic masculinity, allowing men to feel emotions. And if they can feel their emotions, they will feel more comfortable talking about it, what they're going through in their life, and maybe then getting a mental health diagnosis and have a better life thereafter. It's also the same outcome where we allow women to be less than perfect and less than ideal and poised and composed so that they can reach a diagnosis and have a better life. Like in a perfect world, that would be how we get to the root of it collectively.
I agree. But on this topic of stigma, I must say, when I started my journey into psychiatry 20 years ago, the stigma was definitely much more. When I told my parents that I wanted to be a psychiatrist, the impression they gave me was, are you crazy? Terrible to say that word, right? But they asked me that, why do you want to be a psychiatrist? Why don't you do something else? Is it dangerous? So I think things have changed. I think my parents understand my work now and they appreciate what I do. But 20 years ago, it wasn't really the case. I must say we have come quite far. I'm really glad to see campaigns like in Singapore, we have a Beyond the Label campaign. I think he has done a lot of good work in trying to educate the public and reduce stigma. We can do more. I always say that it's better now, but we can certainly do more. We need to normalize such conversations about mental health, mental illnesses, and even about suicide as well. And conversations take place not just at home, but also at the workplace, in schools, in a coffee shop, in a hawker center. I'm not saying we talk about mental health all the time. There's a lot of things in life to talk about. But mental health should be approached as a topic that is just like any others. And the important things about that then is that then people will be willing to open up and share. Like, for example, you hear people saying that, hey, my blood pressure a bit high. Do you think I should see a doctor? The same can be said for conditions like depression, anxiety, or even more serious conditions like bipolar disorder, schizophrenia. We should be able to have such conversations without fear that it will reflect badly on ourselves and things like that. Yeah.
What about lifestyle factors? How can stress and irregular sleep patterns affect bipolar disorder then?
Well, so stress is a big thing we talk about whenever we talk about mental health, because we know that stress can either trigger or worsen mental health condition, including bipolar disorder. Sleep is really important. All of us will need a certain number of hours of sleep a day. A lot of times we will say 8 hours, right? But I think it depends on the age group of the person as well. So poor sleep can certainly lead to a worsened mood or increased anxiety. And we know that in conditions like bipolar disorder, where patients may feel that when they're in the depressed phase, they can't sleep or they sleep too much, when they are having the manic episode or hypomanic episode, they may feel that they don't need to sleep, and as a result, they can get physically exhausted. So we need to definitely pay a lot of attention to stress and irregular sleep patterns when we assess patients who are suffering from bipolar disorder. That's why maintaining a regular sleep schedule, managing the stress, having healthy lifestyle choices, including food intake, nutrition, is really, really quite important. It's not rare to see doctors prescribing sleeping pills to patients with bipolar disorder. Certainly, we are extremely concerned because sleeping pills would sometimes give rise to dependence issue and tolerance. But at the same time, we need to effectively manage the sleep as well. So we do prescribe medications to help patients with sleep and with anxiety, including when they have got bipolar disorder.
As a mental health professional, what would you like to see science and research illuminate or perhaps figure out and essentially resolve for people who are living with bipolar disorder?
Definitely, I think there is a need for more research into the biological and genetic factors. I mean, we have always been trying to chase this holy grail, right? That do a blood test and we can diagnose whether a person has got a mental health condition or not. We're not there yet. Perhaps in the years to come, we will get there. I think the other thing which we can do is using technology and innovation. I remember attending a talk before where there was this particular scientist, a doctor, that actually got permission, it's a research, so got permission to access a patient's social media accounts, emails, wearable data. And he actually used all this information, integrate it together, and figure out by looking at the behaviors online, offline, could actually detect if the patient is going into hypomania, mania, or depression. Of course, if you think about it, there's a lot of privacy issues. Will you give your access to your doctors, right? But it is something that can be done. Yeah, and hopefully now that there's AI on board, we could integrate that even more, yeah, into mental health research.
As we wrap it up, can you tell us why you think more individuals should seek professional help when his or her mental health has tipped off the balance and is not quite right and they are in need of answers to whatever they are feeling? And where can they reach out to you?
I do think that mental health conditions, as with many conditions, the earlier you start treatment, the earlier the intervention, the better the outcome. The same goes for any health condition, not just mental health. And conditions like bipolar disorder, depression, anxiety, they're all highly treatable. So early intervention would be great. A lot of times, the patient themselves may not be aware it is inherent in the illness itself. They may not be aware that they are starting to have certain symptoms. So we assess for insight as well. But as caregivers, as family members, as friends, I think it's not difficult for us sometimes to know that when your friend, your family member, your loved one has got some behaviors that's out of the ordinary. They could suddenly be, hey, how come you're not going out with us anymore? Why are you always at home? Don't you always go out with your friends? Or, hey, how come you are still awake at this time? Why are you posting things online at a certain time? It is 2 a.m. Why aren't you sleeping? So there's these little behaviors. If you feel that your loved ones, your friends, family member seems a little bit off, I know that's not a very scientific word, but you feel that they seem off, spend some time with them. Perhaps encourage them to seek professional help as well. There are many, many avenues of help available in the community. There are counseling centers, there are family service centers, there's doctors, well-trained doctors in polyclinic and in GP clinics that could do the first cut assessment of whether a person has got a mental health issue, and then they can decide to treat or to refer upwards to a specialist if they feel that it is needed. All the restructured hospitals in Singapore today has got a mental health department. We know that waiting time could be very long, but it is certainly important to go to them for help. Of course, there's doctors in private practice, many psychiatrists in private practice that could also help. But check in with them, check with them whether they would be able to see the condition and check with them about the financials as well, because it's important. We cannot talk about seeking healthcare without talking about monetary issues. It's terrible, but I think it's something to consider. Check in with, I think there are online resources as well. The Agency for Integrated Care, AIC, they do have a website that highlights all the available resources in the community. So I do strongly encourage your listener to really take a look at it. I do keep a short blog on my website, so theconnectionsmind.com. If you feel that it is useful, please have a shout out. Please let me know as well. And you can read more about certain mental health conditions on different websites, including my clinics.
Dr. Jared Ng, thank you so much once again for your time today. It has been such a pleasure speaking with you.
Yeah, no problem. Thanks, Brian.
I'm ready to go.